Welcome to this presentation, Advocacy and You. I'm Clarice Grody. I'm an occupational therapist. I'm your presenter today. I am the founder of Amplify OT, which is dedicated to helping practitioners like you engage in advocacy and understanding policy so that you can use it to work for you instead of against you. I'm also a former director of practice for the Missouri Occupational Therapy Association and the current advocacy co-chair for the North Carolina Occupational Therapy Association. And I'm also an ambassador in North Carolina for the American Occupational Therapy Political Action Committee. So I'm here today to bring to you some of the latest advocacy updates and policy updates and showing you how you can use the skills that you already have to be an effective advocate. I find it helpful to start these presentations with reviewing kind of what advocacy is. I think we have this idea of what advocacy looks like, and it looks like, someone attending a protest or holding a megaphone, giving a speech, calling their legislators, right? It kind of feels like these actions that take a lot of time, or there's something that requires an extensive amount of skill and something that I'm just not capable of, that someone who's an advocate really has to be someone special. And I want us to start reframing this idea of what advocacy actually looks like and what it means, because advocacy does not have to be these really big gestures and movements and things that take a lot of time. I know there's a lot of practitioners and students that don't really identify themselves as an OT advocate because they feel like it's just too big of a label to carry. And I hope by the end of this presentation, you will feel encouraged and empowered to know that you are an OT advocate no matter where you are in your career, and that you already have the skills that you need in order to be effective. So the definition of advocacy is actually much more simple than probably a lot of us would think. And really, it is primarily defined here with this definition from the Alliance for Justice as advocacy is defined as any action that speaks in favor of, recommends, argues for a cause, supports or defends or pleads on behalf of others. Now, I bet all of you can think of a time even within the last week, where you have probably done something that spoke in favor of something, right? Or recommended it. You probably went into a patient's room and you recommended that they get out of bed and engage in therapy. Or you recommended that they call their doctor or advocate for themselves to ask for certain services. Or maybe you just explained what occupational therapy is and why they should want to engage in occupational therapy, or why a doctor should order OT, or why they should go to a certain setting for discharge, right? All of these different things are ways that you are using your skills and your knowledge as a practitioner, as an occupational therapy practitioner, to advocate for something that you believe in, whether it be that the patient should engage in therapy and that it'd be beneficial for them to get up, or that the doctor should order occupational therapy for this patient. So there are lots of ways that you are engaging in advocacy every single day. Now, when it comes to why it's important that we advocate, why it's important we understand our role in advocacy, there's a few different considerations. And one of them really comes down to whether or not you view occupational therapy as a profession or a job. Now, a profession and a job are two different things. You can definitely have a job within a profession, but a profession is this idea of having a long-term commitment, right? That we have a sustained investment in something. It requires advanced training, there's the sense of community, and overall the folks in that community are interested in sustaining that profession. Versus a job is something that's generally short-term, it's a means to an end. It may or may not require some form of training, and it generally only affects one individual. For me, occupational therapy is my profession. I think all of us would agree that it definitely meets the criteria of having advanced training, that there's definitely a sense of community. I mean, even AOTA's board where you can comment and post is called Commune OT. We have this sustained interest in there being a profession for many years to come. Versus a job is really something, again, that's short-term. We may not have an investment in. So when I worked at American Eagle in college, as a genes specialist, that was a job. I did not care if American Eagle would be here 1 year, 5, 6 years later. I wasn't invested in continuing to be a profession of a genes specialist, right? So the job was a means to an end. It really only impacted me, but occupational therapy is this broader idea of a profession. It's almost a sense of identity. So when we think about why it's important to advocate, why we should dedicate time to it, I want you to kind of consider, think to yourself, what would you lose if you couldn't be an occupational therapy practitioner? What would that mean for your life? What would that look like? If tomorrow, what if Medicare or other health insurance plans stop paying for OT services? What would that do to your life, to your job, to, the future of the profession, for students? What would that look like? And imagining those scenarios, even though they can feel extreme, just a few bad policies can really get us close to a very uncomfortable position around reimbursement and the sustainability of our profession. So when it really comes down to why should we advocate, it's really how can we afford not to advocate if we want our profession to stay healthy and to stick around for many years to come. We also advocate for other reasons such as professional pride and for influence. So overall, we're advocating generally to increase awareness of what occupational therapy is, right? One of the beautiful things about occupational therapy is that our scope of practice is so broad, but the downside of that is that it can be difficult for others to understand what we do and to explain what we do. And so when we are advocating, we are also increasing awareness of what occupational therapy is, why it's valuable, why others should pay for it, why they should hire us. All of that is a way of engaging in advocacy. We also advocate on behalf of student loans because that is obviously something that impacts, occupational therapy professionals. We also advocate for higher education requirements. We advocate in order to protect our profession. So it's not only about looking at where are areas that we can expand into, but also protecting the area that we have. So there is a lot of advocacy work on educating others on the value of occupational therapy and functional cognition in feeding and swallowing, and even gait training and ambulation, right? So really protecting our profession and our scope of practice and any infringement on that scope of practice. There is multiple instances of where other professions have come close to infringing on the scope of practice. For example, there have been bills proposed by orthotists where they want there to be a special orthotist license in order to make orthotics. Well, one of our scope of practice pieces is that we can make orthotics as occupational therapy practitioners. If legislation like that were to pass, it would prevent us from being able to create an orthotic without getting a separate license from the one we already have, which would be an infringement on our scope of practice. So we are always advocating in order to protect the profession as well as advance it, and especially advocating for that recognition of our value in multiple different areas. We're also advocating for our scope of practice and jobs. Now, I mentioned that a little bit in the prior slide, but a lot of how we do this is passing legislation and policies that protect our profession. One of the main initiatives we had around that was passing legislation to just get our licenses. It really isn't all that long ago that we got our license in all 50 states. So passing legislation and policies that protect our profession. We're also protected against scope of practice expansion or infringement. So asking for our scope of practice to be expanded in terms of what we're able to do. This can look like supervision laws for OTAs and what they do or do not have to be supervised, how they have to be supervised. Is it general? Is it direct? So there's always advocacy going on to expand our scope of practice. Maybe it's direct access, as well as protecting on potential infringement, like the example of the orthotics. We're also always advocating on behalf of payer reimbursement, and that's not a bad thing, right? I guarantee that you did not go into this profession to work for free, right? I picked occupational therapy not only because I like the profession, but because it was a solid job. It paid well, given that I really only needed my master's. So pay and reimbursement is absolutely something that we advocate on behalf of. That's important to advocate because it helps you and I have a job today, but it also helps people have access to our services. Most people cannot afford occupational therapy services out of pocket. And so the more health insurance plans that reimburse for occupational therapy, that pay for OT services, the more access patients have to our services and therefore the more jobs. And other advocacy can look like, why should a company hire an OT practitioner versus someone else? This is especially a lot of advocacy that we see happening in what are called, non-clinical spaces. So looking at case managers or utilization reviewers and advocating for why that position should be filled by an occupational therapy practitioner versus by a nurse or a social worker or someone else. And what goes hand in hand with advocating for that scope of practice and reimbursement is advocating on behalf of our patients and clients. Oftentimes, this is probably the type of advocacy that you can recognize immediately that you do most likely every single day in your job. You are advocating for them to get access to the care they need. So whether that's writing your documentation in a strategic way that makes sure that it's covered by insurance, or trying to get them to the most appropriate discharge setting, we are advocating using our skills and our experience to help patients and clients get access to the care that they need. Advocating for that pre-approval for insurance, right? So writing those letters and documentation and justifying the need for OT, that is a way of engaging in advocacy. So what is it that we observed that indicates that this patient may or may not be safe to discharge home? Or why is it that they need X, Y, and Z services upon discharge? So that is, again, a way of using your expertise and trying to convince others to believe in what you believe, which is that skilled nursing facility or an assisted living facility or home is the best discharge option. And then another way we engage in advocacy is by educating family and friends on patient needs. This is often a role that we play, which is explaining to families and caregivers what is going on with the patient, what's the patient goals, and why certain therapy things are or are not possible, and really helping our patients advocate for themselves, especially if their wishes are differing from what the family wants. Now, to sum it all up as to why advocacy is important, why it's important that we show up, that we be present, is because everybody wants a piece of the pie. So if you think about funding or opportunities as a pie, right, we have to figure out how to divvy that up. So how do we decide who gets the biggest piece? How do we decide who's worthy of that? And then also what happens if we aren't there when the pieces are cut? So that is when you think about funding, like especially Medicare funding, right? A lot of Medicare funding is budget neutral, meaning it can't go up or down, it has to stay the same. So when they split up who's going to get paid more, if they give someone else a bigger piece of the pie, someone else has to get a smaller one. And this can be the same with any kind of budget, whether it's a private practice, whether it's a hospital, trying to figure out where to spend the money, where to allocate time and resources. How do we decide that? How do we pick value? A lot of times we're considering where can I get the biggest bang for my buck? And so making sure that occupational therapy is present, and that's what we mean by saying have a seat at the table, making sure that you are there when those decisions are being made. And this is where, when we're talking about the pie metaphor, this is where we come to the quote of, if you aren't at the table, you're on the menu. So the idea being that if we aren't present, if we aren't advocating for ourselves, that there's a possibility that we're the ones being eaten or that we're not going to get that piece of the pie. So if you're a visual thinker, this is a really good example of thinking of why it's so important that we advocate, is because we want to make sure that we are protecting our piece. So federal legislation is legislation that's governed by the federal government, so the United States House and Senate, the president. It impacts all 50 states. So in the federal legislation, they have a lot of overarching implications where they provide direction to Medicare and Medicaid. So oftentimes our policies for Medicare and some policies for Medicaid come through Congress. So it looks at payment changes, quality metric changes, Medicare coverage, how much they'll pay for our services, those sorts of things. They also set national healthcare laws, which is what we saw with the Affordable Care Act or ACA or Obamacare. They set national standards for what healthcare and what health insurance had to cover. They can also set certain laws about what kind of credentialing might be needed or higher education standards. They establish standards for federal student loans, funding for diversity initiatives, which we'll talk about later in the presentation, and social programs and different forms of protection. So there's a huge impact of different federal legislation, and even legislation that doesn't necessarily directly impact healthcare can still trickle down to impact our profession. So when talking about legislation and advocacy, it's always important to look at where we can advocate, right? Because it's all about knowing what direction to go. And part of that process is how Medicare law is created. And this is your general overview of how a bill or how a law is passed, but specifically looking at Medicare as we go into the rulemaking process. So first and foremost, a bill gets introduced in Congress. So if we want to initiate a new piece of legislation, it has to get introduced. And so once that bill is introduced, it's given a number and it's assigned to a committee. And this is where people are able to lobby for or against the bill. So that's where you have your lobbyists, right? Now, anyone can lobby for or against a bill, but just by calling my legislator or sending an email, I am lobbying for or asking them to not support a bill. AOTA has lobbyists that work on behalf of our profession. So this is where people get to kind of chime in and try and convince or advocate, right, for these legislators to agree with them and vote in their favor. Then ideally, the House and Senate would pass this legislation. Now, both chambers have to pass the legislation in the exact same form. So as you can imagine, that process is quite challenging. So even though I've broken it down into just 3 steps right there, this process can take quite a long time if it's ever successful. And then once it's passed through both the House and the Senate, then the president has the option to sign the legislation into law, or they're able to veto it. So just in those 4 steps, there's really a lot of opportunity for advocacy to change the way something's worded, to ask for occupational therapy to be added, or change language from occupational therapist, occupational therapy practitioner, so it includes OT and OTA, because language in this step is really important and paying attention to what kind of policies are coming through. But after that policy goes through Congress and becomes law, then it goes to the Centers for Medicare and Medicaid Services, or CMS. So this is where the law now is going to be interpreted. I kind of compare this to when we had these activities in school, right, where our teachers wanted us to write out every single step of making a PB&J. So, Congress tells Medicare, okay, I want you to make a peanut butter and jelly sandwich. To make it more specific, they'd say something like, I want you to make post-acute care payments more value-based. Okay, well, what the heck does that look like? And so Medicare now has the pleasure of taking these general directions and laws and turning them from a few hundred pages into thousands of pages of regulation and documents and laws of what does that process look like. So the laws are then interpreted, and these are put into proposed rules. The public is then given the opportunity to comment on these rules, and so this is a really important step of advocating, as there's lots of times where CMS has come out with a proposed rule that either would have been burdensome or didn't make a lot of sense, and so AOTA always submits comments on our behalf, but anyone can submit a comment to CMS, and then CMS has to read these comments, respond to them, and then publish the final rule. Once the final rule is published, this is then implemented by clinicians and providers and becomes the law. So overall, there are so many opportunities to advocate in this stage, and this is just one small example of how law is created. All right, so what role does AOTA have to play in this grand picture? So we're going to go over the American Occupational Therapy Association and some of the different teams that are dedicated to advocating on our behalf. So AOTA is our national association, right? They are the only association that's dedicated solely to advancing the interests of occupational therapy and their practitioners and students. They have 4 primary teams that are dedicated to policy and advocacy. There are multiple teams within AOTA, such as, conference and marketing and the people who put out AJOT. So lots of different fantastic teams in advocacy, but these are in AOTA working on all different facets. But these are some of the 4 primary that are really dedicated to policy and advocacy. So we have our federal congressional affairs, our federal regulatory affairs, quality, and state affairs. And you can find a lot of their updates at aota.org/advocacy. So first up, we have our federal congressional affairs. They are made up of 5 primary team members, 2.5 of which are our lobbyists. So we have 2 full-time lobbyists, and then Heather Parsons, who's in charge of the department, also does lobbying work. She's an amazing occupational therapist who's also a fantastic lobbyist, and we're lucky to have her. So the federal affairs team is in charge of primarily monitoring and lobbying the U.S. Congress and select federal agencies. So this can also look like working with AOT PAC and also organizing our grassroots initiatives like hosting and planning our annual AOTA Hill Day. And they also monitor and influence public policy initiatives. So it's not only about Congress, even though that's the primary work that they do, but also monitoring and influencing other public policy initiatives, such as things that might come out of the Department of Higher Ed or the National Institute of Health. So really keeping an eye on what's going on, especially at that federal affairs level. Now, our federal affairs team does interact with the American Political Action Committee, or AOT PAC, and so this is just educational information about the role of AOT PAC and what it does. AOT PAC is a voluntary, nonprofit, nonpartisan, unincorporated committee of members of AOTA. So it's important to understand that AOT PAC is fully separate from AOTA. AOT PAC is the only PAC that is dedicated solely to occupational therapy. So while there are other political action committees that may impact OT, like other healthcare committees, this is the only one that's dedicated, again, solely to advancing the interest of OT. They contribute money to political candidates who support OT, which is their primary role. So they do follow some of the direction of AOTA, where it's supporting individuals who support our legislation. So there is collaboration and communication, but AOT PAC does have their own separate board from AOTA's board. They also contribute campaign money to OTs, OTAs, and OT students who are running for public office. Now, they are not a super PAC. It's technically what's called a separate segregated fund, And so you are able then to see where money is coming in and out on opensecrets.org. So you can see who contributes money to PAC as well as who they give that money to. It's important to note that no AOTA dues go towards AOT PAC, so AOT PAC can only solicit contributions from AOTA members, but those contributions are fully separate from your AOTA dues. So AOTA dues are not going towards political contributions. And there are contribution limits of $5,000 for donors as well as $5,000 to candidates, and you can find out more information at aota.org/AOTPAC. And this is also an opportunity where if you wanted to be an AOT PAC ambassador, it's another great way to get involved in advocacy, and it's something that I do. And it's a great way to stay in touch with what's going on federally and helping educate others as well. Next, we have our federal regulatory affairs or regulatory affairs. So our regulatory affairs, it's primarily 4 team members. It's a team of lawyers and billing experts. So they really help study proposed rules and final laws and billing changes. So if you think about our federal affairs or congressional affairs team, they really handle the Congress side of how Medicare becomes a law. Our regulatory team really goes with the rule making, so kind of following through with those proposed rules and final rules. They also do a lot with working with private insurance providers and advocating on behalf of OT because there is always something funky going on with private insurance. And they also provide support to practitioners and students, although you must be a member, and track coding changes, payment reform, CMS innovation models, etc. So they are one busy team. If you think about all the different policies going on, all the different private insurers and Medicaid and Medicare, they have a lot on their plate. And you can follow them on Twitter at AOTA@regulatory. So they have lots of really fantastic updates and have a hugely important role. Next, we have our state affairs team. Again, this is also about 4 team members usually. They are responsible for all state legislative and regulatory activities. So they follow a lot of different things. And at the state level, we have some different advocacy issues than we do at the federal level. So they really look closely at Medicaid, right, which is determined by the states. Our scope of practice, which is largely defined by our Practice Act, which is again a state law. Supervision of OTAs is predominantly an issue at the state level, and licensure laws. This also has to do with our licensure compact. So the licensure compact has been driven by our state affairs team at AOTA because that's legislation that, even though it's kind of a national effort, that legislation really has to be introduced in each individual state, so it's still under our state affairs team. They're also a liaison for state associations and regulatory boards. So especially when I was director of practice for Missouri OT Association, I communicated a lot with our state affairs team to ask them questions about different legislation, because it's also not all that uncommon that similar pieces of legislation will be introduced in multiple states. So having a kind of one person that we can go to at AOTA who helps keep track of these issues allows us to not only better collaborate as state associations, but also helps keep an eye on what is going on and what trends are occurring nationwide. So they play a really important role in supporting that advocacy at the state level, and they're also on Twitter. Now, last but not least, we have the quality team. The quality team is a little bit different because there's one quality director, and then the team is kind of made up of members from the other team. So you have members from our, regulatory team, from our education team, from our practice team that kind of come together to discuss quality and what that looks like in occupational therapy. So they really monitor closely quality measures and outcomes that impact occupational therapy. So this has become a really important role as quality measurement, value-based purchasing, those sorts of things have expanded. They work closely with NQF or Battelle as well as other important bodies. So really keeping track of what are the quality measures that are coming out, whether or not CMS is going to adopt them, whether or not private insurance companies are going to take them on, so what's going on there. They monitor quality reporting programs like what CMS has, as well as Medicaid and private insurance plans. They produce educational materials for members and also do quality spotlights, and you can find a lot of their work at aota.org/quality. So currently we are in the 118th Congress. So every 2 years we have a brand new Congress, and why that's important is because any legislation that did not pass the year before in the Congress before has to be completely reintroduced. So this is sometimes why advocacy can take a really long time, because every 2 years we're kind of starting over from scratch. So for a little bit of a civics refresher, The United States House of Representatives, or the House, serves 2-year terms, so every 2 years the entire House is fully reelected, versus the Senate serves 6-year terms, so every 2 years only 1/3 of the Senate is elected. And this is why sometimes things in the House tend to move really quickly, versus in the Senate things take a little bit longer because people have longer terms, so they don't have to worry about re-election so quickly. Currently, Democrats have a very slim majority in the Senate and Republicans have very slim majority in the House. So this is an ideal time for bipartisan legislation, but makes it very difficult to get a lot of things passed because there isn't a lot of agreement when we have split government. So when one party controls the House and one party controls the Senate, versus it's much easier sometimes to get legislation passed through when one party controls both. The goals for this Congress are kind of hard to say. Again, because it's so split, it's been difficult to kind of figure out what are really the primary initiatives. The good thing for healthcare is that there are a lot of shared bipartisan efforts around healthcare involving telehealth, reforming Medicare. But just because there's shared sentiment doesn't mean that it's easy to come to an agreement on what that should look like. But there is hope for getting some healthcare legislation passed. So end of year for 2022, what were some of the wins that we had? Well, one of the biggest wins that we had was the Allied Health Workforce Diversity Act. This was huge, something that we've been advocating for a long time, which what this is requires HRSA to create a grant program to support diversity in OT, PT, speech, and respiratory therapy programs. So this is very similar to a nursing program that already exists in HRSA, but this creates an additional grant funding to support diversity efforts, so both recruitment as well as retention in the allied health workforce programs. So this is a really fantastic opportunity to support that diversity because we know that the more diverse our field is, the better patient experience we have. We also had a win legislatively that involved expanding telehealth waivers. So under the COVID-19 pandemic, the public health emergency, we had temporary expansions of telehealth that covered OT, PT, and speech under Medicare Part B. Prior to the public health emergency, our therapy services were not covered for telehealth at all. So what Congress did is they took action to extend those waivers temporarily through the end of 2024. Now, we still need that permanent solution, so that still requires Congress to make that change permanent. So anytime we have a permanent change to, or really just any change to the Medicare program, that does have to go through Congress. So even if Medicare did support expanding telehealth permanently, Congress has to give the approval and also give the funding. So that is what's holding up telehealth primarily, is that the funding. It's going to be expensive to expand these services, but the good news is there's a lot of appetite for it. So we currently have it covered through the end of 2024, and that was confirmed in the proposed Medicare physician fee schedule, which just came out a few weeks ago, or a couple weeks ago, that said that they will be following through with that. So we know that telehealth will be covered for therapy through 2024, but we hope to see action on that before the end of calendar year. But I wouldn't hold your breath. Congress likes to wait for deadlines before they pass anything, so we shall see what happens. Another huge win was the Lymphedema Treatment Act. So the Lymphedema Treatment Act is another piece of policy that's really been floating around for a long time. And what this did was it expanded Medicare coverage to cover garments that was needed for lymphedema treatment. So Medicare would pay for the therapy and the services that you needed to help reduce the size of your limbs, but they wouldn't pay for the compression garments and some of the pumps that you needed to maintain those services. So fortunately, thanks to a lot of advocacy that did involve advocacy from AOTA as well as our practitioners, the Lymphedema Treatment Act did pass, and so Medicare is now passing those policies to expand coverage of lymphedema treatment. We saw this in the proposed home health rule, and I'm sure we'll see it in other upcoming rules as well, indicating what exactly are the garments that they're going to cover underneath the new Medicare policy. Now, also at the end of 2022, we still had some more wins and something we consider like a partial win. So a big win is our intensive outpatient mental health services. So this is a new Medicare mental health benefit provided for federal qualified health centers and rural health clinics. So this will require occupational therapy as part of these intensive outpatient mental health services. Now, we were already required as intensive inpatient mental health services. So this expansion of coverage for these mental health benefits, it was really helpful for those patients who don't quite require the same amount of hours as someone who's inpatient, but they're still going to have access to OTs. So basically what this requires is that they get screened for the need for occupational therapy. And if it is shown that they need OT, then they are required to actually provide those OT services. So this is huge for occupational therapy and mental health. We also saw an expansion of the BWIT program to include the OTD. So OTD programs are now eligible to apply and receive Behavioral Health Workforce Education Training Grants, or BWIT grants. Now, this was a technical fix. Originally, only master's programs were eligible to receive these grants because at the time, there were not really OTD programs. So we had to pass legislation in order to expand the BWIT program for OTD programs, and now that technical error has been fixed. So OTD programs can apply for these important grants to help support training in behavioral health and workforce, which we know is desperately needed. Then we have the Medicare physician fee schedule. This is the gift every year that keeps on not giving in the fall. So what the Medicare physician fee schedule is, I guess to summarize and backtrack a bit, is that this is how Medicare indicates what they will pay for under Medicare Part B. This is something where that pie metaphor really comes into play because the physician fee schedule is budget neutral. So if Medicare is going to increase payment to one profession, they have to decrease payment somewhere else. So a couple years ago, we saw where they increased payment to primary care physicians, but unfortunately, therapy services were one of the services that got a cut. But we have also unfortunately received those cuts fairly consistently year over year. Congress has taken action the last few years, especially with the pandemic, to provide some relief through temporary increases in funding to the Medicare physician fee schedule. So basically, adding in a little bit of extra pie. They kind of had the original pie and then gave them a little bit of a smaller one to add on, but that keeps expiring year after year. So what happens is we have the proposed draft, the Medicare physician fee schedule, come out that proposes a pretty decent cut, which in 2022, we had a potential 4.5% reduction in reimbursement. And I think if any of us were told we were going to have a 4.5% cut in pay, we'd be pretty upset. But thanks to congressional action, it was reduced to an only 2% cut, so not ideal, but still better than 4.5%. They also took action to provide a temporary 1.5% increase to the Medicare physician fee schedule next year, and there are still additional cuts. So we aren't fully sure on what's going to happen, whether or not Congress is going to take action, but CMS in their new rule did propose a 3.5% cut, or approximately 3.5%, for calendar year 2024, so that includes that 1.5% increase. This is a major area where AOTA is advocating for change, where they just released a statement between AOTA, APTA, and ASHA indicating a lot of the problems with the Medicare physician fee schedule and how therapy services have really received the raw end of the deal in terms of reimbursement that's really hurting access to our services as well as hurting providers in these areas. So there is a lot of efforts and interest in permanently reforming these areas, but what that will look like and how long it will take is still quite up in the air. So we shall see what happens with the Medicare physician fee schedule, so stay tuned. The final rule generally comes out around November, and then usually Congress waits until the very last minute to take action if they are going to do anything. So we shall see. So what advocacy efforts do we have that are ongoing? So these are some advocacy efforts that some are a little bit new, others are carried over, because remember, we started a new Congress this year, so anything that didn't pass last year had to be fully reintroduced this year. One of the advocacy efforts that we've really been taking on is changing private practice supervision. So currently, Medicare Part B for private practice clinics only requires direct supervision for OTAs. We are asking them to change it to general. Now, this has been part of one of the SMART Act that was introduced in the House, and that one expired, so it has not yet technically been introduced, but they're still working on introducing legislation around this issue. Medicare, though, has indicated that they may potentially take this on themselves without congressional action. So we have not had to deal with direct supervision requirements for a few years, since 2020, because Medicare put in a temporary waiver. Really why this is burdensome, because direct supervision requires that the OT be in the same clinic as the OTA. So this is really hard for some of our private practice folks, especially people who are like OTs in the home or home mods communities. Basically, it restricts OTAs from ever seeing Medicare Part B patients in those types of settings, which can make it really difficult. It's also really burdensome for our rural clinics, because especially when it's difficult to find an OT, you basically makes it really difficult to have a private practice clinic in rural areas, because if the OT is out of town or they're unable to come into the office, the OTA then cannot see any Medicare Part B patients if that direct supervision isn't provided. So we are asking for them to permanently change it to general supervision so it's consistent with all other settings in Medicare, which just basically means that the OT has to be available. So we are asking for that permanent change. So we have both attempted through Congress, but now Medicare has indicated in their proposed rule that maybe they will consider it on their own. So stay tuned, but that's an area that we're hopeful for. Along with this, which is something I forgot to add to the slide, is that we are advocating on behalf of exclusions for the OTA payment differential for medically and rural underserved areas. So the OTA payment differential is where Medicare Part B pays 15% less for services provided by an OTA versus an OT. It also applies for PTAs versus PTs. This was that part, the 2018 Balanced Budget Act, that permanently repealed the therapy cap and unfortunately included that payment differential for OTAs and PTAs. Now, I do want to say that AOTA and APTA were not aware that that provision was going to be added to the legislation. So unfortunately, when the bill passed, AOTA found out with everyone else that that provision had been added. So even if there had been an opportunity to advocate and there wasn't, AOTA would not have supported adding in the OTA and PTA payment differential. But unfortunately, it is there, and Congress is not interested in removing it, but they have been willing to potentially consider exceptions for medically underserved and rural areas, so areas where there are really healthcare deserts, where it can be hard to find an OTA. And these are things that impact not even just private practice, but also skilled nursing facilities where we really rely on OTA support. So this has been disproportionately affecting individuals in that area, and so they're asking for exceptions for those areas. Other things that we're working on is funding the Allied Health Workforce Diversity Program. So we have now officially created the Allied Health Workforce Diversity Program, but now we need funds. First step was to create the vault for the money, and now we are asking Congress to fill that vault with money. So that is an advocacy effort that we are currently taking on. Another huge advocacy effort is the follow-up to the Medicare Home Health Flexibility Act, which is the Medicare Home Health Accessibility Act. What this bill does is it makes occupational therapy a qualifying service in home health. Currently, under the Medicare Part A home health benefit, a patient is only eligible to receive home health if they have PT, speech therapy, or nursing on the initial order, not occupational therapy. This has been an issue since the 80s. It has to do with the fundamental misunderstanding of what OT is, as well as issues with licensure. We had to first get the ability to initiate the OASIS, which is why we had the Home Health Flexibility Act that passed in 2020. Now that we have the ability to initiate the OASIS, we are able to ask for OT as a qualifying service. This bill does have pretty decent support. It was just, if it's not officially yet introduced, it's close to being introduced, and so hopefully we can get this bill passed. The Flexibility Act took around 8 years to pass. Hopefully this one doesn't take as long, but it does have a cost associated with it since it's expanding the Medicare program. So we shall see. Any bill that requires funding sometimes can have negative consequences, like the OTA payment differential with the therapy cap repeal, but also generally it just takes longer to pass. Next up, we also have the Expanded Telehealth Access Act. This would make telehealth a permanent benefit under Medicare Part B. Now, what's a huge success is that they automatically included occupational therapy in this legislation. So we have been advocating for telehealth coverage for years. And when I say we, I mean advocates like myself, AOTA. But they've been advocating for years to make telehealth a permanent benefit under Medicare Part B. And so we have been going in there, educating legislators on occupational therapy, telehealth. And obviously that has stuck because when they wrote this bill, they automatically included OT without us having to be asked. So even if this bill doesn't pass, that is a huge win in and of itself because they are recognizing that we provide a value. This is where advocacy is kind of the long game. And so this is a bill that's introduced to make that a permanent benefit under Medicare Part B. Again, in Congress, there is a lot of bipartisan support for telehealth, but it will have a cost, so we'll see what happens. We also have the OT Mental Health Parity Act. This is a carryover from last Congress, so it's been officially reintroduced in the Senate. The OT Mental Health Parity Act does not actually change any policy underneath Medicare, but what it does is require HHS to issue education on what services are already covered. So occupational therapy is already a service covered under Medicare for individuals with a psychiatric diagnosis as their primary diagnosis. OT is reimbursed for mental health services under Medicare Part B and Medicare Part A programs. What this bill is basically asking is for HHS to provide that education to remind folks that it is a covered service. Now, this bill has already had a positive impact in reminding people that OT is a covered service under Medicare. It also would have them look at what states cover OT for mental health under Medicaid. So if this bill were to pass, there would just be further education, but it does not actually change any payment policy. So hopefully we can get this bill passed as well. One of the other bills that AOTA is listed as advocacy on is the SHARE Act. Now, this bill is a little bit technical, but what you generally need to know is that this bill is important for a licensure compact. It basically allows for better exchange of information between the FBI and states. So when you're doing your background checks and those sorts of things, and it would help with sharing that information for the licensure compact once we are able to get that up and going. So the SHARE Act, it was a technical error that was caught by our wonderful folks at AOTA, and now is a piece of legislation that we're advocating on behalf of. Now, there are always other advocacy efforts going on, and multiple other ways to get involved, like participating in work groups around quality measure development, work groups addressing interoperability in healthcare, advocating for more function and self-care quality measures in those quality programs, looking at minimum staffing requirements in nursing homes, the unified post-acute care payment model, private insurance, Medicare Advantage, prior authorization rules. So lots of advocacy happening all across the board. The ones that we highlighted are primarily just the ones happening in Congress, but these are also equally important advocacy efforts that deserve your attention and that fortunately we have AOTA focusing on as well. So there are lots of opportunities to protect our profession, advance our profession, overall improve the quality of our profession and access to our services. So here's how you can advocate. First and foremost, be an AOTA and state association member. Your membership is really your investment in the success and longevity of this profession because, let's be frank, you are benefiting from the advocacy that's happening on your behalf regardless of whether or not you're a member anyways, so you might as well support the efforts that are going on and think about how much more we can accomplish if we had more personnel and more funding to take on those initiatives. I think of my membership as both my state and my national association as my investment in continuing to be an OT. I spent a heck of a lot of money to become an OT, so I'm willing to spend a little bit of money each year to make sure I can continue to be one. So these support the individuals that are advocating on our behalf every day. It also gives you exclusive access to information on issues that face the profession, because if you're waiting to hear about an issue from your boss, either you're going to hear about it wrong or it's already too late to do anything about it. So finding out about that information now is really helpful in having an effect. You want to start advocating when the rule is being made, not after it's already been finalized, and it's much harder to change. Another really important factor of being part of your national and your state association is that they help provide a voice for you at both the local, state, and national level. So by being a member of both of these organizations, you're really able to help cover your bases because, as we've kind of discussed a bit in this lecture, there is important advocacy to happen not only at the national level, but also at the state level, because the state level is where a lot of your scope of practice, your supervision laws, your licensure laws, that's where a lot of that law happens. And then our national law, which has to do with a lot of Medicare reimbursement, national health insurance laws, recognition as mental health providers, loans, budgets, grants, all sorts of things. So, and that happens also again too, even at the state level. So it's really important that we have recognition at these different levels. So without our state associations, we definitely wouldn't be where we are with licensed in all 50 states. And without our national association, we absolutely wouldn't be where we are today, especially if you look at issues around telehealth and home health. Another important part of this advocacy is helping protect that competitive pay for OTs and OTAs. You know, healthcare is a business as much as we may not like it, but it's really important that we have adequate reimbursement, that we have coverage of occupational therapy services, because that is what helps pay us, right? Our companies can't pay us if they aren't getting paid accurately. So whether that's advocating for competitive pay for our services through reimbursement, or just advocating on the value of occupational therapy, publishing research, all those sorts of things help demonstrate the value and the importance of occupational therapy services, which is what helps you get a job and keeps you paid. So it's important to remember that it takes a village, and being part of your state and your national association helps support that village, helps support the profession of occupational therapy that you are a really important part of. Now, if you're feeling like advocacy is something that just is hard, that you're not sure if you're able to do it or where to start, I wanted to include this slide that shows that you already have the skills that you need. Because on the left side of the column, we have a list of ways to advocate. So identifying the issue, doing your research, right? Identifying the desired outcomes, right? It's hard to advocate if you don't know what your goal is. So what do you even want? What are you asking for? Identifying and building allies, so finding the people who support you, considering outside interests and opposition. So what might the people who disagree with you say, and how can you respond to that? Crafting and tailoring your arguments to the person that's in front of you, and speaking up and speaking often, right? Those are kind of the general steps of how to engage in advocacy. But if we take those steps, which can seem a little overwhelming if you haven't interacted with them before, and translate them into words that we use every single day in occupational therapy, then you can see that you already have these skills. You're already engaging in them, just maybe in different ways that you aren't identifying as advocacy. So when we look at identifying the issue in occupational therapy, we analyze the task, right? That's what we do every single day. We look at the barriers, we look at the supports. When you're doing your research, you're utilizing evidence-based practice. So you're already looking up what is the best thing to do in this scenario. And it's the same thing when you're advocating. Support your decision. You're identifying your desired outcomes. You're establishing goals, right? Something that we're used to doing all the time, looking at goals, making sure they're reasonable, thinking them through, setting objective timelines. That is all an important part of advocacy. Step 4, identifying and building allies. Well, we identify supports and include the patient in their plan of care. So it's the same thing, right? If we're trying to advocate to Congress, we're figuring out, okay, who's going to support me? What are the legislators that believe the same thing as me? What are the legislators who have talked a lot about the importance of bringing access to healthcare in rural areas, or those sorts of things? You're identifying the people who are most likely to support you and identifying what supports exist for your argument. And then step 5, considering outside interest and opposition, well, you identify the barriers. Again, something that we do all the time and that we are experts in, identifying those supports, those barriers, part of that task. What is getting in the way of me achieving my goal? What thoughts might people have? What predispositions might they have? And that's an important part of advocacy. Number 6, crafting and tailoring your argument. Well, that's building buy-in and insight, right? Something we do all the time, again, with patients, where we're convincing them to engage in therapy and educating them on the importance of therapy and the importance of getting up out of bed or of drinking their water or whatever it may be. We are building that buy-in and building that insight. And the way that we do that is by tailoring our discussion. Because if you have a patient, let's say, who you're trying to motivate them to get out of bed, and now for some of your patients that maybe have grandkids, it might work well for you to be like, don't you want to get back home and play with your grandkids again, right? But if you have a patient who doesn't have grandkids, say they're like 30, you're not going to be like, oh, don't you want to go home and play with your grandkids, right? No, of course you would never do that, because you're tailoring your discussion to them. So maybe you're talking to that person based on what their goals are, which is maybe to get back to work or whatever was meaningful to them. And so you tailor your argument to the person you're talking to. And it's no different when you're engaging in advocacy. So that's why when you talk to your boss, maybe you're advocating on productivity, thinking about what their goals are. Yes, they care about patient outcomes and those sorts of things, but they're also concerned about fiscal responsibility, about productivity, about managing staffing levels. So how can you tailor your goals and your points to fit their goals? How can you kind of build that buy-in from them by tailoring your argument to best fit their beliefs? And that last step of speaking up and speaking often, this one easily translates into educating and adjusting the plan as needed. So making sure that you are sharing your voice, you are providing that education as to why it's important to believe whatever it is that you believe. And then, of course, make adjustments. If you find that an argument's not working, you change it. If you find that they're asking questions that you don't know, you research it, right? So the same thing that we're doing every single day with patients is the exact same skills that you can take and apply them to just about any other scenario in order to advocate. Because yes, occupational therapy practitioners, we are experts in function and mobility and cognition and mental health, but really it's the way that we think about problems, the way that we analyze situations, the way that we communicate that I think truly sets our profession apart, and that is what can make us such effective advocates. So don't forget that you are the expert on occupational therapy. Even though you may not feel that way, even if you're only 5 days into your program, an expert is someone with a comprehensive knowledge or skill in a particular area, and I guarantee that you, just by knowing what OT is and having gone to school for it, that you know more than the average person that's sitting across from you. So remember that you are an expert in that task analysis, problem solving, plan of care, and goal development, and tell me anywhere that those 3 skills wouldn't be useful. And I think you'll have a hard time coming up with a list, which is why I think occupational therapy practitioners can truly save the world. So, don't forget to participate in your local and state advocacy. Here's how you can get involved. Of course, exercising your right to contact your representatives. So just like at the national level, you do have a state house and senate, except for Nebraska, which is unicameral. You also have your mayor, your city council, school board, lots of folks that you can get in touch with. That's your right to communicate with them. Participate in community events and leadership roles, right? You can always run for office. We have an occupational therapist who ran for Indiana State House and won. Attend your state Hill Days. Most states do have an annual advocacy day or event, so make sure to attend those. Volunteer for your state association. I can guarantee that your state association would love if you would volunteer. We are always looking for additional help, and so getting involved, even if you don't feel like you have a particular skill yet, this is such a great way to network and develop your skills and build into a leader, and also really helps with that sense of community, especially if you aren't really feeling it at work. Volunteer for local work groups and engage in advocacy. You can build relationship with local departments of aging or public health. Look at your company's policies and systems that impact your community and your patients. Are there ways that you could be involved? Is it changing an intake form to be more inclusive? Look, there are so many different ways that you can be engaging in advocacy that can look so different that are still really meaningful. In federal advocacy, it looks, again, very similar. Exercising your right to petition your legislators. It's the same thing as contacting your representatives. AOTA, fortunately, makes it super easy to do that, especially on issues related to OT. So you can use aota.org/take action. And this is a website where they have pre-designed template letters that you can send to your representative based on issues that are impacting occupational therapy. Now, it's definitely encouraged that you change them and have them fit your story and give them some personal stories to them, because then they're more likely to be read by your legislator and have an impact. But it makes it advocacy super easy, and you can send one of those letters in under 5 minutes. You can attend AOTA's Hill Day. This year, they're going to do another virtual again in October. So that's an advocacy intensive where there'll be trainings and you can send letters. So it'll be a really great event to make some time for. You can volunteer for AOTA positions for the Representative Assembly and other committees. Again, another super great way to get involved and somewhere we're always needing more help. You can also participate in national organization groups working on health policy and advocacy. So if you want to be outside of occupational therapy, pick something that's interesting to you and get involved, because I guarantee that your skills will be useful. Or you can also be an AOT PAC ambassador for AOT PAC. These are just some pro tips when engaging in advocacy with stakeholders and legislators. First and foremost, identifying their goals. So what are their goals? Is it patient access? Is it costs, jobs, taxes, clinician burden, or burden on the state, etc.? So what are their goals and how can you make it relate to them? It's just like when we're talking to a payer, right? A health insurance payer. We are not going to go to them and say, I'm not making enough money, because they don't care that you aren't making enough money, right? That's not the insurance's payer's responsibility. What they care about is whether or not their patients, whether or not their beneficiaries are getting access to their services. So while I can go in and say, unfortunately, patients aren't receiving access to services because reimbursement was cut, it's sending the same message of I'm not getting paid enough to provide care to those patients. I have to turn them away, but it's saying it in a way that connects what I'm saying to their goals. If I just walked into a meeting and said, I'm not getting paid enough, so I need you to pay us more, they're not going to respond to that. But if I can say something of, unfortunately, due to the reductions in reimbursement and the increase of costs of labor, we are unable to accept these patients, and therefore they're unable to get access to care. That is connecting the dots for them and identifying their goals and how I can help them meet their goals, which if they raised reimbursement, I could help them meet their goals by getting their patients access to care that's less expensive than going to the hospital. Adapting your argument based on who you're talking to, so always keep that in mind. Remember when you're speaking to legislators that you're for the party of occupational therapy. So this means that we do have to reach across the aisle. We have to work bipartisanly because that is the best way to get legislation passed. And some ways to think about that is just what is best for occupational therapy and how can we support that? Because there are allies for occupational therapy across all of the aisles. Never assume that they know what occupational therapy is. So some of the friendlier ways to ask this is, are you familiar with occupational therapy? This kind of gets them to open up and maybe tell a story. Pretty much everybody has some story about either a friend or themselves who had an injury in high school and had PT or therapy of some sort. But that's a little bit of a friendlier way of versus just asking them, do you know what OT is? Because that kind of makes them put them on the fence. So make sure you have a little bit of your elevator pitch ready and be ready to kind of gently correct them when they're like, oh, well, OT does hands, right? Well, we do work with hands, but this is really what occupational therapy is about. So ways to kind of gently redirect that conversation. Remember that staffers are key to the castle. Never be disappointed if you meet with a staffer instead of the actual legislator. They really hold an important role, and they are the ones who help convince their boss and keep them on task. So if you can make a friend of a staffer, you've really made it far. And don't forget to remember your goals. Other disciplines often come up in conversations. What's physical therapy versus occupational therapy? What's the difference? So remember that your goal is to be there to talk about occupational therapy. So you can always kind of, again, redirect, well, physical therapy, they're a great profession, but I'm really here to talk to you about occupational therapy and what it is that we do. So don't forget why you entered that room. And always tell your story. So when you're going into with advocacy, think about the stories. And this can be the same thing if you're talking to your boss, a payer. What's the purpose of your story? What are you trying to communicate? Who was the key players? What happened? What was the outcome? Why does it matter, right? So if I'm talking about an experience I had where one of my patients didn't get the care they need because of the way the law was written. And so I talked about, my patient was a key player, I was a key player, the nurse was a key player. What happened? Well, the nurse wasn't able to go out, only I was able to go out. Unfortunately, that meant that the patient didn't get care, and as a result, they just kind of got dropped. And so what was the outcome is that they didn't get access to care that easily they could have gotten access to had the law been different. And communicating why that matters. Now this patient who had a recent stroke, they're going to have a delay in care that maybe it will take them another week to find a home health agency. So what kind of decline are they having during that time where they're not having intervention? So never assume that they understand what occupational therapy is and why it's important. So make sure to put that into your story. Now, again, remember, there are so many ways to engage in advocacy. So these are what I like to call our daily advocacy. So just educating others on what OT is, introducing yourself to patients and clients, gentle corrections when we're called a different profession. I can't tell you how many times I walk into a room and they're like, oh, my nurse is here. I'm like, actually, I'm occupational therapy, right? Giving patients the tools that they need to advocate for themselves, communicating your observations and assessments. I would often go out and chat with the nurse or the case manager to share what it was that I understood, what I saw with the patient, what might, impact them. I'm not going to give them my full summary, but if I'm talking to case management, I'm more likely to communicate with them what I'm thinking of discharge planning and why I'm thinking that way, because that helps them do their job, but then they also start to see the value of occupational therapy, and I start getting more referrals because they start to understand what it is that we do. Make sure you're speaking up during meetings, So no one can help you if they don't know that there's a problem. So make sure you're asking questions. You're pointing out if you disagree with something, asking for policies. Those are really great ways to engage in that kind of daily advocacy or asking, what about occupational therapy here? Engage in value-based care. Be a good steward of the profession. You never know who you're going to be working with, who knows who. So always being a good steward of the profession is a great way to build allies and engage in advocacy. Documenting your skills, billing appropriately for services. Not only is it legally required, but also it's an important tool for advocacy because that's often how payers, people like CMS, Medicare, private insurers understand what we do is based on what we document. They don't see the patient. They don't know what they look like. All they're looking at is your documentation. So it's up to us to really paint the picture of what it is that we bring to the table. And then participating in communities at your facility that address quality or patient outcomes. So even if, again, you don't feel like you have the skills right now, go ahead and volunteer yourself. It's a great opportunity to learn, and I bet you know a lot more than you think you do. So these are lots of examples of ways to engage in that easy, everyday advocacy. So don't forget, the profession needs you. So whether it's just being a good steward of the profession, if being a member is all you're able to take on right now, that is still a really great way to engage in advocacy. But if you're ready to take that next step, definitely consider advocating or volunteering for your state association, your national association, a local organization, your hospital, wherever you can be the future of occupational therapy, and our profession needs you to get involved. So parting thoughts, advocacy and change isn't something that happens to us. It's something that we need to be active participants in. Trust me, change can happen. It's often the long game. So even though it's not always satisfying for things to happen quickly, we do see progress over time. So again, the question isn't how can we afford to engage in advocacy? How do I have time or be a member? The question is how can we afford not to? So if we don't advocate for occupational therapy, then who will? All right, that's it for me today. Thank you so much for taking the time to listen to this presentation. Please let me know if you have any questions. Please email me. Let me know what you think, if you had any inspiration or takeaways. Always happy to chat with you. You can also find me on Instagram, also on my podcast, the Amplify OT podcast. So let me know if you have any questions, and thanks so much. And remember that we need the special skills that you bring. All right, have a great day.